Hi everyone, my name is Anita Wallace and I'm Chair of the Lymphedema Support Network. And I'm delighted to welcome today Dr. Catherine O'Leary, GP from Oxford, who is joining us for the fourth in our series of our expert question and answer sessions. So welcome Catherine, and thank you so much for agreeing to join us. So Catherine, we've had a request for some help with someone who says that I'm an expert patient, but how should I respond when my GP thinks they know better?
So, yeah, I think that's a tricky situation. I guess from a GP point of view, we see patients with so many different conditions that we inevitably can't be expert at all those things. So we are dependent on our patients to, tell us their story and give us an idea of how it is to walk in their shoes. So I'm sorry some of your patients have told you that they're getting this sort of response from GPs, but I think probably it's about increasing the GP knowledge of the condition. So maybe, as we said before, signposting them to your organisation. I guess really lymphedema and lymphatic system may be slightly different to some of the other conditions we deal with, because often those conditions might be treated with medications and referrals from operations and things, and lymphedema is kind of different to that in that we don't have drug therapy we can use. And we don't have a sort of speciality that we can refer them off in the way we would with cardiology and neurology and all of those things. So we've got some of us have great lymphedema clinics, and I think often a lot of the care for the patients may end up happening there if the GP isn't able to sort of run with this themselves. But I think just keep talking to your GP and sharing the information that you have, and hopefully the dialogue will continue, and hopefully with the little bit of work I'm doing with trying to increase the knowledge amongst GPs, there'll be less GPs out there who don't know so much about lymphedema, or at least what first steps to take, all the non-medical measures that we would talk about with skincare and exercise and compression and all those things. So hopefully, and with the learning module, the more GPs that do that, the more they'll realise that they do have something to offer these patients. But inevitably, you as the patient will have better knowledge than the GP in most instances.
Thank you, Catherine.